Today, I wanted to talk about some pending changes to the way that Medicare pays you. The fee schedule will be coming out sometime around July 4th, and this is a preview of what it will almost certainly include. The first issue is that there will be a cut. The statutes that deal with Medicare will cause a cut to appear in this fee schedule. That is not the final word on this, and it's another reason for you to engage in federal advocacy with the Congress. The Congress over time has almost every year blunted the cut that they have in statute. Then the regulators have to follow through with that blunting of the cut. So that'll be something that happens throughout the year. This cut is going to look like 2.93% based on the statute that exists at this time. But there is an opportunity for us to engage and make sure that that cut doesn't continue. That follows on every single year, it feels like, cuts that folks have had to deal with. And what's really damaging about these cuts is it's not limited to Medicare, because so many private contracts are actually based on a percentage of Medicare. So if Medicare gets cut by 3% and you're paid at 140%, there is a cut even in the private pay rates that you'll receive. Medicaid sometimes, CHIP, all of those things get pegged to the Medicare rates most of the time. The second thing that we know will be in this regulation is some consideration of continuing telehealth. And shockingly, even though that wasn't used too often, except during the pandemic by physical therapists, it's something that patients like. And it's something that, when it comes down to it, gives you more flexibility to provide care that is high quality and supplement in-person visits. The problem with telehealth is that it is expensive. More people end up using services because they have more access to it. So it increases the federal debt and burden on the Medicare program to pay for those services. So it's always scored, it's always analyzed to increase Medicare costs, I would argue, because more people are getting services, and that's not a bad thing. That's why we have the Medicare program to begin with. Folks are getting care. So that will have to be addressed in some way by both the Congress, and it will appear in this regulation, some analysis of how telehealth and some draft rule on how telehealth will be impacted. The third thing is, in the last final rule, and even in the draft rule, there were discussions of revaluing certain codes. Many of our codes are in that revalued bucket, and so that is a way that the RUC, the AMAs, American Medical Associations group that helps to value codes. Sometimes you see RVUs, or relative value units, associated with a CPT code. Those RVUs get set by the AMA and then modified or directly published by by CMS. So CMS depends on the AMA in many instances to value different CPT codes that are proposed and go through the RUC process. Those RVUs then determine how much you get paid. They eventually get multiplied by what's called the conversion factor, and we know that 2.93% cut will be reflected in the conversion factor. But it's really important to know that those RVUs could shift either up or down. We're hopeful they'll go up, but that will be part of the process that CMS looks at. It's almost never something that Congress engages in because it's really technical, but there will be some shifts to those CPT codes, RVUs, possibly not in this regulation, but they're certainly coming. So APTA and others are working very hard to try to make those RVUs as juicy as possible for our members so that they can get paid adequately and provide services for their patients. We'll see the publication of the fee schedule, the draft fee schedule, and remember, it's draft, so we will have a final fee schedule that will come out, but the draft is likely around 4th of July. The final fee schedule is close to November 1st, right around Halloween, so boo for everyone. So I'm Bob Hall, work with the AOPT as well as the APTA Private Practice Group. We have a new payment consortium we're standing up. I would urge you to subscribe so that you can learn and get updates about what we're doing on behalf of your practice.